Did you know that around 11% of the total disability in the UK is due to low back pain? In fact, one study showed that 1 year after a first episode of low back pain, a whopping 62% of those people were still in pain. And around 16 people unable to work were still not able to work 1 year later. We therefore know that for a large amount of people in the UK, and you may be one of them, back pain is a recurrent problem. So how do we stop back pain from coming back? Well, in this video, I'm going to show you how we can do just that and how you can finally become pain-free. Now, my first recommendation, like I've said in all these videos, and I keep going back to this because it really is the best way to combat any issues that you're having in the spine, and that is to see a chiropractor. This way you can get your problem properly diagnosed and then properly corrected at the root cause of the issue. Now, the core is made up of an abundance of muscles completely surrounding the spine from front to back. They play a critical role in protecting your spine as you go through the everyday traumas. Without these muscles, your spine will go through a lot more trauma than it already does. They also play a vital role in enabling you to perform almost every action with your hands and your legs. If your core doesn't contract fast enough, then what tends to happen is that you get more wear and tear within the joints of the spine. That then causes inflammation and therefore results in more back pain. So this can be a big reason why back pain keeps coming back, is that your core is not able to properly protect and stabilize the spine. So although you recover, after a while you then just traumatize it again, and it can seem like you're doing the most trivial things, such as bending over to pick up a pen, and that's when the back goes. It's most likely because the function in your back is so low that it just can't cope. So this exercise that I'm going to go through with you today is an exercise designed to properly strengthen the core, but not only strengthen the core, but strengthen it in a way that it's designed to be strengthened, and that is stabilization. Your core is not designed to flex up and down repetitively under load. It is designed to stabilize as you move your arms and legs and to stabilize your spine. This exercise is one of the best exercises we know that challenges the core enough to produce some good results, at the same time keeping the trauma to the spine as low as possible. So for example, a plank could be very useful and do a similar job. However, a plank puts a lot more pressure through the spine. So if you are vulnerable and susceptible to low back pain, then I would not start on the plank, although the plank is a good exercise to progress to, but a better exercise to start with would be the one I'm about to go through. So the exercise we're going to go through is called Burdog. It has 5 different stages. Each one is going to get more difficult as we go along, and it's going to challenge the core to a greater extent. So for the first stage, what we're going to do is get into the all 4 position. We're going to have 90 degrees for the shoulders and the hips. And the most important part of this exercise is to keep your spine nice and level. So what we're going to do before we even begin is place a ball onto the low back. Now you can essentially use any ball. You can use a golf ball, tennis ball, or a football. You just need something that is going to give you some feedback to tell you whether your spine is twisting or not as you go through this exercise. Once you have the ball on the back, what you're going to do is just contract your core about 20% before you go. This is just going to engage the muscles around the spine. And then the first stage is simply to lift up one leg. Now the most important thing here is to do these movements as slow as possible. The slower you do them, the more you're going to get out of this exercise, particularly on the way down. What you want to avoid on the way down is to stop the leg from going out to the side before it comes back in. You want to make sure it goes nice and straight and then down. Very nice and controlled is what we want. Then after you've done that leg, then you can switch to the other leg, and then you can repeat this anywhere between 5 and 10 times on each leg. Just do it within your own tolerance. Then for the second stage, all we're going to do here is add in the arms. So while you lift up one leg, you're going to lift up the opposite arm, and you can do it at the same time. Remembering to do it nice and slowly and keeping the spine nice and level. You don't want it twisting. And by keeping it nice and level, you are engaging the core as it is supposed to. What will happen if you don't engage the core is that you will get a twist, because the weight of the leg is going to twist the spine, and then you'll see the ball fall off. So once you've really mastered this exercise, then you can take the ball off. But the ball is very essential at this point, just to give you that feedback, because otherwise it can be very hard to know if you are actually twisting or not. Similar for the first stage, you can repeat each side around 5 to 10 times, again within your tolerance. Now for the third stage, to make this a little bit more difficult, you're going to bring the hands and the knees a little bit closer to each other. This is going to bring your center of gravity closer to the middle and make it a lot harder for you to balance, and therefore engaging your core even more. You then can do this exercise in the exact same way as we did the second stage. Now for the fourth stage, what we're going to do here is we're not going to actually alternate. This time we're going to do all our reps on one side before then switching over to the other side. By doing this, you're not giving that side much of a rest, which is therefore going to work it a little bit harder. And then after you've done those reps, you can then switch to the other side. Now for the fifth and final stage, here you're going to close your eyes. Now the reason for this is that your eyes play a massive role in balancing. If you've ever stood on one leg, you'll know it's a lot harder when you close your eyes as opposed to when your eyes are open. It's because your brain needs your eyes to see your surroundings, to give you the information it needs to keep you upright. However, your eyes aren't the only way that your body can balance. You actually have receptors within your body that give you a position sense, so it can tell your brain where each joint is. So this stage is going to increase the need for you to balance with everything else but your eyes. The fifth stage is going to be the same as the full stage. You can do all the reps on one side and then switch to the other side, or maybe for this one, if you want to, you can switch it up and alternate on each side. Now, as I say with any exercise that I prescribe here, obviously I can't see you, I'm not able to examine you, so please do proceed with caution. If anything causes any pain, then just either stop or reduce the amount that you're doing. So you just have to play around with it, but really do listen to your body, because your body generally tells you what it likes and what it doesn't like. So there is the kind of good pain and there is the bad pain. The good pain would be the kind of pain that you expect from muscle workouts at the gym, and you're trying to push yourself and you get that delayed onset soreness the next day. But pain that is very sharp, or anything that is very unusual, or if you're just not sure, then I wouldn't proceed. Now the last thing I will say in terms of preventing low back from coming back all the time is that you do have to remove the traumas. So things such as stressful positions, poor posture, sitting at a desk, particularly if you're sitting at a desk with a laptop, lifting heavy objects with poor form, anything like that. So you really have to examine everything that you do and ensure that you're giving your spine the best chance. If you keep traumatizing it, then of course it's going to keep coming back. So the analogy of hitting my thumb with a hammer is only going to stop coming back if I take away the hammer and properly allow the thumb to heal. So to make this exercise particularly effective, you do have to ensure that you're giving your spine the best chance. Thank you for watching this video. I hope you found it useful. Please do give these exercises a try and comment below how you get on with them. Do hit that like button, as it really helps to get this video out to more people, and be sure to subscribe, as I'm going to be posting more videos every single week. Have a great rest of your day. Love you all, and I'll see you soon.